So now I'm performing the Houston's test. This is used to assess anterior lateral rotor instability. Positive result at 20 to 30 degrees of flexion. The lateral tibia jerks forward as the lateral tibial plateau subluxes. I'm going to start at 90 degrees. And then I'm going to apply a valgus stress, but at the same time I'm going to be doing knee extension where our foot immediately rotated. So I apply my valgus stress right up in here. Got the foot, I'm going to immediately rotate, and then I'm just going to extend while I got the valgus stress and immediately rotate the foot. I'm going to go back up and I'm going to just extend it again. All right. Now I'm going to do it bilaterally. So now I'm doing the Houston's test on the other side bilaterally. Going to 90 degrees. I'm going to apply the valgus stress while the foot is immediately rotated. Valgus stress and the foot is immediately rotated. And I'm going to simultaneously put the knee into extension. I'm going to just go back up to do it again. And that's the Houston's test. So now I'm doing McMurray's test. This is used to assess the integrity of the meniscus. Positive result is audible click or joint line pain. Got my hands right over the joint line. I'm going to laterally rotate the tibia and extend the knee, but I want to start in full flexion. So lateral rotate the tibia. Going to get my hand on the heel. I'm going to extend the knee while the tibia is laterally rotated. I'm going to go back up so I can do it again. Extend the knee. So now I'm going to do it bilaterally. Alright, now I'm doing the McMurray's test on the other side. Get my fingers in the joint line. I'm going to laterally rotate the tibia. Put my hand on the heel. Extend the knee. Go back up so I can do it again. Extend the knee. The tibia is laterally rotated. That's McMurray's test. So now I'm performing, the camera's messing up a little bit. Now I'm performing aptly distraction compression test. This is used to assess the integrity of the meniscus of knee or ligaments. Positive result is pain with distraction, ligamentous pathology, and pain with compression, meniscal pathology. Go and flex the knee for me. Put my stabilizing hand right here. I'm going to compress right here on the heel. And while I'm compressing, I'm going to laterally rotate, immediately rotate the foot. So I'm laterally rotating, immediately rotating while I'm compressing. Now I'm going to do this. That was the compression portion. Now I'm doing the distraction portion. So I'm going to distract, but I'm going to immediately and laterally rotate the foot while I'm distracted. Now I'm going to do it bilaterally. So do the same exact thing. I'm compressing, immediately and laterally rotating. And I'm distracting now, immediately and laterally rotating. And that's the aptly distraction compression test. So now I'm doing the Noble compression test. This is used to assess the IT band friction syndrome. Positive result, pain occurs at about 30 degrees for full flexion. I'm going to have my hands over the IT band just proximal to the lateral femoral condyle. And all I'm doing is I'm going to passively or actively extend the knee. So I'm going to flex her up, get my hand over that IT band, above the lateral femoral condyle. And all I'm going to do is passively extend the knee. I'm just passively extending the knee. And I'm going to do it bilaterally on the other side. So I got my hand right there over that IT band again. And I'm just passively extending the knee. Passively extend it again. And that's the Noble compression test. Alright, so now I'm running the patella apprehension test. This is used to assess patella dislocation. Positive result, this patient prevents maneuver by reactively contracting quads or stops the test for fear of patella dislocation. I'm just getting on the patella, and I'm going to be applying a lateral force slowly to glide the patella. So, apply the lateral force. Got a little movement in there. Do the same thing on the other side. I'm going to apply the lateral force. And that's the patella apprehension test. Okay, now I'm performing the active lateral glide test. This is used to assess the the tightness of the lateral thigh structures and quad muscle imbalances. Positive result is excessive lateral versus superior movement of the patella. I won't be really doing anything because this is an active test, but I'm going to instruct my patient to contract their quads, and I'm going to look for the movement of the patella. So I'm going to go in and do both at one time, since, Alright, go in and contract the quads. Try to bring your toes to your face. And I'm just observing the movement of the patella, and that's basically the active lateral glide test. So now I'm performing the patella glide test. This is used to assess the integrity of the patellofemoral joint articulating surface. Positive result is pain with quadriceps contraction. I'm going to put my hand over the superior part of the patella, and I'm just going to push down a little bit. And I'm going to instruct the patient to contract the quad. So, all right, contract the quad. Contract it. All right. Go do it to this side. And I meant a positive result is pain with quadriceps contraction. I forgot to mention it. So push, get the superior part of the patella. I'm going to push down. Contract the quad for me. Contract it again. All right. And that's the patella grind test. So now I'm performing the Wilson test. Since this is an active test, I'm just going to record my patient doing it. This is used to assess the presence of osteochondrin discecans of medial femoral condyle. A positive result is pain in the knee about 30 degrees from extension. So I'm going to go in and put the camera on my patient. And basically, what I want you to do is I want you to immediately rotate your foot for me, one at a time. Now go and try to extend that for me. Alright, go right down. You feel any pain?
No.
Alright, do the other foot. Go and extend it for me. Okay. Feel any pain?
No.
And that's basically the Wilson's test. So now